My name is Danielle and we're nursing students, and we're going to be doing a scenario today. I'm going to be the nurse in this scenario.
My name is Amy Baumgartner, and I'll be playing Mary, the patient.
Okay, and our scenario is Mary is having medication side effects, and she's afraid that her doctor is going to stop seeing her because of her medication side effects.
Come in.
Hello, Mary. My name is Danielle, and I'm going to be your nurse today.
Hi, Danielle. Where's Dr. Anderson today?
Dr. Anderson is in with other patients, but he'll be in about 10 minutes.
Oh, thank God. I just love him so much. He is the best doctor I have ever had. I mean, ever. He is so friendly, and that smile of his. Oh, I am just so lucky to have a doctor like him.
I'm so glad that you feel that way. Could you tell me why you came in today?
I came in because I've been just feeling a little off these past couple days. I've been nauseous and I've been vomiting. And this has been about 3 days now that I've been vomiting.
Okay. Can you tell me if, are you getting worried about it?
Absolutely. I am really worried that the meds I'm taking are making me sick. And above all, I'm worried that Dr. Anderson is going to stop seeing me because the medication is making me sick.
Okay. Can you tell me more about why you think Dr. Anderson will stop seeing you?
Well, it seems like I have been sick a lot since I started seeing Dr. Anderson, and I feel like I've been a really big burden to him. And pretty soon he's just going to get fed up and tell me that he doesn't want me as a patient anymore.
That must be really frustrating, and it sounds like maybe even a little scary for you to think that your doctor, who you admire, and it sounds like this is the best doctor you've ever had, might stop seeing you.
It is really frustrating. When my grandpa was sick, his doctor stopped seeing him.
And that must have been very frustrating for him too. Can you tell me more about that?
Well, I have a great grandpa. He just loved us grandkids, and he would tell us story after story after story. And one of the stories that really sticks out in my head is him telling us that he went to a doctor, started taking medication, went back and told the doctor that he was starting to feel sick, and he thought it was because of the meds he was taking, and that doctor stopped seeing him. So then my grandpa was left with no medication and no doctor, and I'm really scared that that's going to happen to me.
Okay, well, it sounds like this is really bothering you, and I can assure you, the one thing I can assure you is that as long as I have been working with Dr. Anderson, he has never dropped a patient because of medication side effects.
That's really good to know, but I'm still not sure.
Okay, well, is there anything that I can do to make you feel more comfortable?
I don't know if this was allowed, but do you think maybe you can stay in the room with me when I tell Dr. Anderson about what has been happening with my medication?
I would be happy to stay in the room with you if that makes you feel more comfortable. Okay, Mary, now that you've seen the doctor and you've expressed your concerns, how are you feeling now about talking to the doctor about medication side effects?
I feel like Dr. Anderson is going to be very open anytime I have other concerns about medications. He seems like it happens to a lot of people. A lot of people can get sick because of the medication that they're taking, and Dr. Anderson was so great telling me that it was his job to find something that is just beneficial to me and doesn't give me the bad side effects that I've been seeing. And I feel like I'm very comfortable coming back in and talking to him more about side effects.
That's really good to hear. I have some information for you about the medication that he has prescribed now. It's similar to the medication you're taking. Some side effects that you might see is nausea, vomiting, drowsiness, suicidal thoughts, anxiety, dizziness, blurred vision, and excessive sweating. And if you have any of these side effects, we really encourage you to come in, talk to the doctor. It sounds like you're more comfortable with that now. And just let us know what's going on, because there's always something that we can do for that. So, do you have any more questions?
I don't. Thank you so much for helping me out today.
You're welcome.